Dr. Derek Burke's contract as head of clinical governance at the GHA ended last month. On Sunday, he sent an email to all GHA doctors highlighting contractual obligations that he says conflict with General Medical Council good practice, creating a situation where speaking up is advised in one but prevented by another. Dr. Burke says GHA doctors are advised to speak up by medical guidelines but are prevented from doing so due to being bound by the same contractual obligations as civil servants. He says civil servant general orders state a duty to give undivided allegiance to the government at all times, and that there should be no discussion of matters of current or potential political controversy. The General Medical Council's good practice guidelines say that the care of your patient is your first concern, and that prompt action should be taken if you think a patient's safety, dignity, or comfort is being compromised. Dr. Burke says that many in the GHA have concerns regarding patient safety because of governmental decisions being made. He claims there's been a collapse of a management structure at the GHA and the Ministry of Health, and that neither the ministry nor the acting medical director, Dr. Krishna Rawal, have been responding to patient safety concerns raised. He describes the GHA as a toxic environment, claiming that staff who consider escalating concerns outside of the organisation due to its inactivity are threatened with action taken against them for breach of contract and/or the Official Secrets Act. Dr. Burke's letter warns his former colleagues that if they do raise issues, they'll likely come under personal attack. He says this is condoned by the government and orchestrated by what he describes as a cabal of senior members of the government and civil service. He issues advice to doctors on how to escalate patient safety concerns based on GMC good practice through the GHA structure, which he describes as a poorly performing organisation. He says there are a number of such issues currently in the GHA, and that some are leading directly to harm or preventable death. But in other cases, harm due to the issue is not imminent or is hard to relate to a specific issue. In his letter, Dr. Burke says he's been keeping the GMC up to date on issues in Gibraltar during his 4 years in the post. It's not the first time Dr. Derek Burke has written a letter containing allegations of this nature. One dating back to November 2020 was brought to Parliament's attention earlier this year. It also said there was a cabal of individuals within the GHA that were directly or indirectly responsible for preventable harm and deaths at the organisation. The Chief Minister and the Health Minister told Parliament there was not a shred of evidence of this. GBC asked the government for comment on Dr. Burke's most recent letter, specifically whether there have been instances of preventable harm or death at the GHA. We also asked whether it agrees that there is a conflict between the civil servant general orders and the General Medical Council's good practices. We also asked, given that doctors in the UK are not required to sign the Official Secrets Act or an equivalent to the general orders, whether the government would review this for doctors locally. And we asked what representations Dr. Burke has made to the GMC. In response, the government says Dr. Burke has begun proceedings against the GHA, with his claims including allegations against the organisation and against individual medical professionals. Therefore, it says the matter is sub judice and it will not comment further in relation to any matter raised by Dr. Burke.